Hi orthopedic friends, this is Dr. Mora. I'm going to show you how to identify a root tear. Why do I keep talking about root tears? Because they're very important. If you have a root tear of the medial meniscus, the likelihood of you developing arthritis to the point that you need a knee replacement is very high. The likelihood of not needing a knee replacement is much better if you have a root tear repair, especially if it's done correctly. So how do you identify it? First of all, it starts with a history, just like everything else in orthopedics. Usually it's a 50-year-old patient, abrupt onset posterior knee pain. The pain is in the back of the knee, and it's quite severe, and it usually happens with simple walking or going down the stairs. Pain is in the back of the knee. In most cases, an x-ray is done, and it shows a little bit of arthritis, but that's not the cause. An MRI hopefully gets done, and this is what you see on the MRI. Here is a coronal view of the MRI. Medial side, lateral side, medial meniscus, slightly extruded, but that's not the most important part. Most importantly is this right here. In the back of the knee, you see this gap right here. This gap is very important. It's called a truncated meniscus sign. I like to just call it a gap. Go to the back and look for the gap. You see this is a lateral meniscus, and there is no gap because it's normal. Medial meniscus, there's a gap right under my finger there. That's a gap. Go to the back, look for the gap. Don't forget that. Then when you go on the side view, or also known as the sagittal images, here they are, sagittal images. How do you find a root tear, or what are classic signs of a root tear? Find the ACL, then you find the PCL right afterwards, and the normal meniscus should be seen right here. But when you have a root tear, you actually don't see anything. We call that the ghost sign, the ghost sign. So let me show you what I'm talking about. There's the medial meniscus right there, then it disappears. There's the medial meniscus right there, and then it disappears. That's called a ghost sign, or the way I like to describe it, if you've been ghosted by the meniscus, you have a root tear. So once again, what's the easiest way to see that? Find the PCL head medially, which is usually 1 or 2 clicks. That was 1 click, and there's 2 clicks. No meniscus, you've been ghosted, you have a root tear, or you're dealing with a root tear. So once again, here it is, MRI, frontal view, also known as the coronal images. Go to the back and look for the gap. Sagittal view, find the PCL, 2 clicks medially, 1, 2, you should have a meniscus there, and if you don't, you've been ghosted, you're dealing with a root tear, and with that information, you can provide the patient appropriate information to help them make a good decision. In most cases, a meniscus root repair will be beneficial for that patient, and you just might change that patient's life. You guys take care. Have a great day. Comment, share, and follow. Take care.